What our clinic does is address a huge gap which exists in the public system. And when I talk about the huge gap that is based on the needs of cancer patients, it is not dictated by policymakers or healthcare providers like myself. It is based on the findings of credible, reliable sources of information like the Canadian Cancer Society, which found in a survey of cancer patients that over 80% of these patients are looking for services like what Medicare offers. And that includes a wide variety of services like support, information, having someone who they can depend on, an advocate who would help them navigate the system.
But isn't that available currently? I mean, I'm pretty sure it's available at the Juravinsky Clinic here in Hamilton. There are programs that provide support to patients, cancer patients. Why would I pay $2,500 to you when I can access that information free of charge elsewhere?
Well, we're unique because the services that we're providing are all supervised by a physician. And let me get into a little bit more detail. Our physicians are trained to deal with the complex and varied issue of a cancer patient. They don't just deal with the tumor, they deal with your whole person care. They will look at all the options that are available to you.
But this is really the thin edge of the wedge, isn't it, as far as cancer treatment and private health care in Ontario is concerned. We already have the reality where multiple myeloma patients who require Velcade treatments must go to a private distributing center or a private medical center for a $60,000 5-month treatment. That's the only way they can get the Velcade now, and they're cancer patients, and it's covered by OHIP. We similarly have cancer patients going to the United States for treatment. And just last week, we had the Ontario Health Minister say that it was acceptable under his current plan for cancer patients in this province to purchase their drugs at an American hospital and have them administered in an Ontario hospital. So this is the thin edge of the wedge, and I think the wedge is simply going to get broader.
And that's precisely the problem. And look, I have nothing but good things to say about Dr. Khan and her professional ability. However, the problem is that what we're seeing here is the growth and development of a two-tiered healthcare system where those with money get to the front of the line and get preferential treatment, whether it's in terms of the cancer treatment drugs that the government talked about last week, where it acknowledged that rich patients could afford to buy these drugs, whereas patients who relied upon the public programs are going to be denied them. Here, we've got the thin edge of the wedge being driven pretty far with a private, for-profit operator that is going to have wealthier clients.
But Peter, if the public system were as efficient as it's supposed to be, you wouldn't have this thin edge of the wedge, and you wouldn't have the reality of Ontario cancer patients having to access a private clinic in order to have a treatment, the only treatment that they can get for multiple myeloma.
And you're right.
It doesn't work.
One of the concerns we've been raising at Queen's Park in terms of the attitude of this government about health care and about public health care.
But Peter, it wasn't any better under your government either.
Oh, Roy, with all due respect, in the early 90s, in a deep recession, the government of the day got itself into real deep political trouble by generating huge deficits to maintain levels of health care.
Who decided that we didn't need any more doctors?
Well, the federal government made that decision, and provincial governments followed along.
Come on, Peter, it was Mr. Ray, and it was your government.
I'm sorry? No, my government was an NDP government. Mr. Ray is the Liberal candidate that you're speaking about, I presume.
You can do better than that.
But the problem... The problem is that we aren't giving adequate access to all of those patients in Ontario who need it in the public health care system. It's a problem of resources. It's a problem of management. The violation of the Canada Health Act by permitting private for-profit health operators isn't going to help, because what it will do is give the federal government, with whom Mr. McGuinty already has a very shaky relationship, an excuse, for instance, to start defunding Ontario even further. I think it's a very dangerous proposition.
What's the alternative?
I understand why Dr. Khan is doing it, and I understand why patients will be paying for the service.
Peter, what's the alternative when you already have patients going to the United States, when they have no other option?
Well, look,
when the government actually sends them to the United States, what is the option? You can't take any more tax money from people. And if you look at just the delivery system, it is so strained that it can't accommodate what's necessary now.
A dollar spent on health care is a dollar spent on health care. Quite frankly, private health care expenditures are far less efficient, in my view, in my submission to you, than our public health care expenditures. People are going to be spending money at private clinics, whether it's here in Ontario at Dr. Khan's clinic, which I tell you I believe is a violation of the Canada Health Act. We'll see what happens. Or whether it's spent stateside. I say let's invest that same money in public health care so that everybody benefits.
I want to bring Dr. Khan back into this discussion and ask you about what Peter just said. Have you just contributed to a two-tier healthcare system with the establishment of this clinic?
It's definitely not a violation of any of the existing provincial laws. What we are charging for is this electronic health record. They will pay for this. It will expedite their care, it will make their care safe, and it will be the investment in their health.
Well, Dr. Khan, it is the thin edge of the wedge, isn't it?
It is absolutely not thin of the wedge. We're not charging for any insured services. You can go to Future Shop, buy a computer. We're selling it to you. We're putting our own custom software on it. In fact, the Ontario government recently came out with a report which said investing in e-health is the single most important thing that the government can do to improve the health of the Canadians. And there are more than 32,000 Ontarians whose health is worsened because of medical errors, which could be avoided by simply having their health records on their hand to tell them about their drugs, their allergies, their medications, their past history. It doesn't need internet access. And I think these are the type of things which a private clinic can do, which the government has been struggling with.
Private health care is on the way. That's inevitable.
Okay.
Well, of course, because there are so many things which the public system cannot do.
Dr.
Humera
Khan and Peter Kormos, thank you both. I'm sure that this discussion will continue on.